Welcome to AXREM Insights, developing healthcare through medtech and innovation. Join Melanie Johnson and Sully Edgington as they talk with our industry leaders and experts.
Hello and welcome to episode 3 of Meet the Team. We are your co-hosts, Melanie Johnson and Sully Edgington. Today we have the pleasure to be speaking to Huw Shurmer. Huw is the Strategic and Government Relationships Manager for Fujifilm UK and has been the AXREM Vice Chair since the new year. Now let's get ready to delve a little deeper.
So welcome, Huw. And this is one of the interviews that I'm most looking forward to because I know we can have a bit of fun with this. So welcome to our podcast, and I'll hand back over to Mel to start the questioning.
Yeah, so with our podcast theme being Meet the Team, I will hand over to you, Huw, to tell us a little bit more about yourself and what's your story.
How far do you want me to go back?
As far back as you like. We want to find out everything.
So I guess left university, went undergraduate and went to work supporting primary care. Enjoyed working there, then went back to university and then went back into primary care again. And then from then on, I built my way up through management of primary care, then into an IT department as a web designer right at the beginning, and designed one of the first websites for NHS Wales, and then moved into doing training records and that kind of stuff all online. And as I moved out of managing the general kind of IT stuff and seeing how the rest of the hospital worked, I kind of got an interest in how waiting lists, efficiencies, all that kind of stuff worked. And from the research that I'd done at postgrad level, which was in IT, I realized that waiting lists and hospitals work very similar to the way that computer architecture works in a strange way. So I applied some computer architecture prioritization algorithms in my kind of spare time to how waiting lists managed, and realized the waiting lists dropped down. So by prioritizing the way that patients walked around hospitals into different departments in the same way as IT and data is managed on a computer, managed to put efficiencies into the system. And from then on, I was pulled out of IT to go and do performance management, then modernisation and innovation. Ended up managing a radiology modernisation project in the hospital. Got exposed into the PACS procurement world, and then a little while later, I joined Fuji, implementing and doing some work with them, and that's where I've been since. I started with Fujifilm back in 2005-06 when I finally moved across to Fujifilm. Started as a project manager for a couple of installs in Wales, then moved into Northern Ireland, did some in Scotland, managed the relationship with London LSP, then back into Wales for the PACS contract there, and then into broader program management. And now I sit on the senior management team doing the relationships with the key accounts and strategic accounts and government relations and the wonderful world of AXREM.
Thanks, Huw. Now, I don't feel like you went quite far back enough. So I know you quite well, Huw, and I know that there was pre-healthcare. So it would be great to just find out a little bit more about what you did before you came into primary care and the healthcare sector.
So that really is knowing too much about me, Sally. Yeah, so my undergraduate degree was in theology. So I was on the route to become a priest then, I guess. And the church felt that I was a little bit young and I should go and get some broader experiences. And that's how I really ended up back in healthcare, because they suggested I go and work in a caring health environment. So that's why I ended up in primary care, getting some broader life experiences. And then after that, I kind of stayed there.
You never went back.
I know that we've used you to give prayer before meals before, so Huw is available for bookings for for doing prayers before meals and things. But no, that's all
religious joyride.
We needed to include that, I think, because it really does show the person behind, what we all see at Fujifilm Healthcare. So I'll hand back over to Mel for your kind of next question.
Yeah. So what's been one of your biggest challenges in your life or career, and how did you overcome it?
Wow. I'm trying to filter out the stuff that I can't really say publicly.
I was going to say maybe working with me could have been one of your biggest challenges, but we've overcome that.
Daily basis. Oh, biggest challenges. I just can't think.
Are you telling me you haven't had many challenges in your life?
But none of that I could probably say without there'd all be commercial ones that I wouldn't want to necessarily say.
So, Huw, since being members of AXREM, what has been the most significant changes you have seen within the association? Because obviously we're on a journey, we're not there yet. It's a constant roller coaster. And I think that you've got enough visibility now where you may have seen some changes. So I'd love to hear from you what you think those are.
I think the most encouraging thing is actually the membership size. I think that when I look back at when I started, even 3 years ago, we were a much smaller organisation, and the membership since then has really increased so much. Actually, just was almost 4 years ago, isn't it? And that has just brought us the visibility and the credibility that we've got with the government, with policymakers, and broader. And I think it's good for AXREM that we've got a bit more diversity there, because I'd like to push more on how AXREM members can work together. I think we've got, because we're so broad now, that the companies with the larger portfolios can help the smaller companies, but also then maybe bring them into their fold. And I think we could probably do a bit more work on how we work together as AXREM, as a number of companies. But I think the biggest thing that we've got is really the membership that's given us our clout. The more of us there are, the more visible we are, the more influence we have. But I also think we still got to remember that we've got that core responsibility for an imaging industry. I like the way that AMA is getting us the visibility broader than that, and that I think is showing great benefits and cost savings to the NHS as well. So I think I think those two things almost go hand in hand, because they both aim in at that visibility but membership, and then the increased AMA as well. I think that's probably the biggest things that I've seen in the last 4 years.
Yeah, definitely. And I think, AXREM was a very different organisation when I joined 5 years ago. And I think we've really professionalised what we do, and we've got a lot more governance, and obviously hand in hand with growing the membership, we've obviously now got more engagement as well, especially in our exec committee. I mean, you've been to the last few meetings and seen a very full room. We're going to need bigger rooms soon, for the engagement that we're getting, which is really positive. And members like yourself make my job easier. So having members that are committed and engaged, and you guys are the experts. And I think we've become a lot more collaborative and inclusive. And like you say, I'm really positive. We were talking the other day on another podcast about the diversity of AXREM. So I'm really positive to see that diversity, and I want to build on that a lot more. Following on from that question, obviously I've seen a lot of changes in the NHS since COVID, but even before that, obviously the NHS and the government has changed a lot over the last 3 or 4 years. What do you think are those significant changes? How is it changed for industry in terms of how you're doing business, or how you're engaging with your customers, and maybe how they're changing the way that they do things as well?
I think it's funny enough, I was talking about this with someone day before yesterday, and I think a lot of this is down to the pressures that everybody's under. So NHS is a very different organisation now to what it was when I was working there, or when I left there. And there's a lot more pressures to cut costs, to do things in a different way, to maybe centralise. And there's a knock-on effect with that kind of work, for almost like the devaluation of the staff and the workforce who work in there. And you end up in this vicious circle then of how you interact and do business outside. So that pressure the NHS is under, and the workforce are under, and the costs that they are faced with, and I mean kind of individual pay as well, that then ends up being translated onto business and engagement, and the cost savings have to come back through industry and the way that we work. And it sometimes feels as well that because of those pressures, that the NHS itself, in order to make those savings, are just going to keep doing the same thing as they've always done. It's easier for them to roll over the same business case rather than think of something more in an innovative way. And I just wonder, as business, we work really well with AXREM. We are competitors. We work under the competition law, but do we need to kind of put our arms around the NHS and protect it a little bit and say, are there easier ways of us working that can help you and take that pressure off them and take pressure off us as well?
I totally agree. And I talk on a daily basis about one NHS, but actually over 400 individual trusts, and obviously more consistency and more standardisation would help everybody. It would create cost savings, would make the job easier for industry, and it would kind of streamline everything. So I think that's definitely something that we need to look at.
And I think, look at the stuff that we've done with DTAC. I think that's a really good example of how we can all find a way of working or advising in better ways.
Absolutely. And you mentioned as well about workforce, and obviously there's a huge workforce crisis in the NHS. We see that every day in our work and when we speak into the different royal colleges and societies that we do. I've always said that innovation and your technologies can really help with the workforce crisis. It's the quick fix, because the workforce crisis isn't a quick fix. Even if we suddenly recruited lots of, clinical healthcare professionals now, we're not going to see the benefit of that until the future. So my next question kind of nicely leads into that. In the last 5 years, I've seen in industry advances around innovation and technology. If you could travel in the DeLorean back to the future style and travel 20 years to the future, what do you think our industry might look like then? Because as a good example, I used to work as an orthodontic nurse and stand in a very darkened cupboard under the stairs in a building in Cambridge developing the images. And obviously now you take an image and it appears on the clinician's screen almost instantly. So I'd love to kind of get your perspective on where you think we might be in 20 years' time with the, with AI coming in and different technologies that we're seeing.
I'd like to think that we'll see some kind of sense, and a lot of the barriers and the different layers of healthcare boundaries between trusts and everything will be broken, that you're looking at a proper IT enhanced service where there's image sharing, images are available everywhere, that the patient can see more of what's being done to them. I think we'll be in more of a genetics managed service by then. But will we go around full circle? But when you look back at how the NHS started, which was really for emergency, some elective, that there'll be some kind of specialist areas and specialist centres with more community services for diagnostics that are maybe a lot more mobile, straight into people's homes, wearables, AI and enhanced transitions of that data back into a central hub for results and all of that. So I just wonder if there's a lot more comprehensive, community, personal-based diagnostics and healthcare system that is then maybe managed a lot more remotely from specialist areas.
Do you think that's a realistic target within the next 20 years?
Well, look at where we've come from in the last 20 years. I think that if you look at the natural progression of cloud technologies, everybody's phone is connected at the moment. I've got an iPhone that can tell me how lazy I am and how many steps I haven't done in a day. So why can't it tell me how healthy I am? It can do my blood pressure. It can tell me my pulse. I think it's only a matter of time before all those kind of vitals can be monitored a lot quicker. The only downside of it is it'll probably end up then being things like influencing your health insurance and all that kind of stuff. You end up paying more, but that's a world I don't really want to think about.
I was going to say, it's actually quite scary to think 20 years ahead, because if you think what a mobile phone looked like 20 years ago and what it looks like now, and like you say, basically it can track us everywhere we go and everything we do, it knows. Quite often you open your phone and you've just had a conversation about something and an advert pops up on your phone about what you've just been talking about. So it's actually quite scary to think where we could be in 20 years. But ultimately, where we are going to be in 20 years is that more patients will be diagnosed quicker, will be treated quicker, will get put on the correct patient pathways, and everything will be tracked at every point. And technology, I think, is going to help with, obviously finding, cures for different diseases and for cancer and other stuff like that. And I'd love to think that in my lifetime, a cure is found for cancer, because wouldn't that just be such an amazing thing? And we hear the statistics of the cancer rates at the moment, and it's shocking and worrying. The NHS is working under immense pressure, and I take my hat off to anybody that works in the NHS, and anything that we can do to make their job easier, I think is in our gift, really. So yeah, thanks Huw for that.
Okay, so Huw, quirky question.
I'm nervous about this, Mel.
It's not that bad, honestly. If you were going to a fancy dress party, what would you dress up as and why?
And what do you want me to give you some thinking time, Huw? And I've got a bit of a funny story here. So I used to work at a company quite close to where Fujifilm, the head office is. And I've always been a fundraiser. So I've done lots of fundraising over the years and raised a lot of money. But I organised a fancy dress at work and I drove to work dressed as a nun. The looks that I got on the way to work really were amazing. I mean, I pulled up at some traffic lights and you can imagine, you know, it's early in the morning, you've got your workmen in their vans and they're just looking at me as if to say, what is going on? Especially, I'm not your typical looking nun. So yeah, that we had quite a lot of fun that day. So hopefully that will get your mind boggling now as to what you would be.
I did think of one the other day, and I thought that would be really good if we went to a party dressed as that, and then I've forgotten completely what it is.
I'm sure you've been to plenty of parties where you've dressed up.
Oh heck, yeah. So I've also been to a party dressed as a priest, but that was an easy one for me, and people said it was far too convincing as well.
What about a famous musician? I know you have musical blood in you and you play in a band. Is there a famous musician that you aspire to be, that you would love to be mistaken for?
I don't think I've got the looks really for a rock god, have I? I went to a party once. Me and my wife went as Mr. and Mrs. Potato Head.
Oh, excellent. I think we need to see these pictures.
Yeah, and I did, on my stag do, I was dressed up as a one-man band.
Oh, fantastic.
It's not fantastic. It's not a fantastic thing at all, because when you go out dressed as a one-man band all day, you've got boom, tss, boom, tss, boom, tss, boom, tss, every step you make.
Try to work out the logistics for that, actually.
Yeah, I feel like this could be a future entertaining piece at one of our events, Mel, or one of the, you know, like UKIO, we could have Huw Shurmer, the one-man band.
There we go, we've got our entertainment sorted.
Yeah.
Believe me, that would be painful.
I know, that's great. And yeah, we were actually just working at the moment, myself and Mel, on entertainment or something for our UKIO drinks reception. So we'll definitely keep you as our emergency reserve in place, Huw.
If that's the case, I may not be in UKIO.
So thanks for your time today, Huw. I think we found out a lot more about you and I'm very much welcoming the time that you're going to spend working with us, obviously as vice chair for the remainder of this year and then moving into the chair position for the next couple of years. I know that myself and you are working on a new strategy that will replace our manifesto and we're looking to publish that later this year. So I'm really excited and I can see that you've got a lot of passion for the industry and for wanting to do the right thing. So I think that this is going to be a really exciting time for AXREM and our members. So a big thanks to Huw for being our guest for today and thank you to listeners.
And join me and Sally next week when we will be speaking to AXREM conveners Sarah Cohen and David Britton. If you have enjoyed today's podcast, don't forget to hit subscribe or feel free to share the podcast with friends.